Okay, everyone, good afternoon. A very warm welcome to our webinar this afternoon on contextual readiness for transforming learning disability services and careers in the UK. I'm Jonathan Webster. I'm Professor of Practice Development and Co-Director of the Impact Research Group at UEA, and my colleagues will introduce themselves to you shortly. Professor Kim Manley is manning the chat box. So can we ask you please to pose any questions that you would like to raise in the chat box, or any comments that you would like to put in there as well, that we would really welcome that. Can I ask you please just to make sure that all cameras and microphones are turned off, and we would really sort of welcome interaction and comment through the chat box as we progress to today's webinar. This webinar is also being recorded, so we anticipating that by joining you are consenting if you do share any comments, but it will also be available on our YouTube channel as well post webinar. Could we have the second slide, Emily, please? So I will hand over now to my two colleagues, Professor Sally Hardy-Dean at the School of Health Sciences at UEA and also co-director of the Impact Research Group, and Associate Professor Carrie Jackson, who is also Director of the Impact Research Group, who will now take us through our webinar and will introduce further colleagues who are participating today. So thank you.
Thanks, Jonathan. So good afternoon, everyone. Thanks for joining us. We have a host of special guests today that will be helping Carrie and I take you through different aspects of learning disability, innovation and transformation. One of the things that I wanted to say at the outset is that we will use the terms interchangeably, learning disabilities with intellectual disabilities. So some of you may be more familiar with one or the other. Both have implications and connotations that we are perhaps not that happy with, but in the UK and England tends to use learning disability, whereas on an international scale, we do tend to use more intellectual disabilities. So may I now just introduce colleagues who are going to help us with the presentation. So Carrie, you should know. Carrie, do you want to just say hello?
Hello, everybody. It's really good to be here. Thank you.
Thank you. Ruth, would you like to just introduce yourself?
Hello everybody, I'm Ruth Northway and I'm Professor of Learning Disability Nursing at the University of South Wales.
Thanks, Ruth. Fabian?
Hello everyone, my name is Fabian. I'm Professor of Special and Inclusive Education for a German online university.
Thanks, Fabian. Neve?
Hi everyone, my name is Neve Walsh. I'm a registered nurse in intellectual disability in the Republic of Ireland and I'm a PhD researcher at Ulster University.
Thanks. And Daniel, please.
Hi, my name's Daniel Marsden. I'm Senior Lecturer in Learning Disability Nursing at Kingston St George's and representing the Kent Surrey Sussex Learning Disability Community of Practice this afternoon.
Thanks, Daniel. So each of our guests will be sharing an element of their work with us, and I'm hoping that towards the end of the webinar, some of the team here at UEA will be able to join us. They're teaching at the moment, and they're hoping to join us towards the end, so I'll introduce you to them a bit later. Next slide, please, Emily. So today's webinar, we're looking at transforming LD services and also thinking about promoting and encouraging people to think and understand more clearly what a career offer there is when you're working in learning disability services and working alongside people and families. So we're talking first about, well, what is the contextual readiness? What's the landscape that we're living with at present, but also what's on the horizon? Ruth will then talk to us about some of the research perspectives and her career about research taking place. Then Fabian will talk us through some of the practice and education initiatives that he is working with. Daniel will talk through the work of the Kent, Surrey, Sussex communities of practice and some of the innovations they've been leading on. And then Professor Owen, Niamh Walsh and Paul Gellan will share the work that's been taking place in Ireland about implementing political change and the impact of utilising the passports. Then there's some time for us to think about, well, what's next? And that's where hopefully we'll have some panel discussions. And also we've got the opportunity to look at some advanced practitioners talking about LD practice that is based on the Health Education England website and freely available to you look at later if we don't get a chance to cover it today. Thanks. So where are we now? As you all are probably very, very familiar with, we are in a process of managing a COVID environment where we are constantly getting different messages about whether to stay at home, whether to go to work, whether to be indoors, outdoors, in groups, not in groups. And we know that those messages are confusing, but we also know that people living with learning disabilities like routine. And there's been some lovely work by Steve Hardy looking at people's experiences of living with COVID, and his colleague Peter, and I believe there's a booklet, and I will find the link and share that with you as we get going. So the COVID pandemic has had significant negative consequences. We know that the mortality rates of people with learning disabilities from the leader reports remain significantly high. And also there has been some wonderful work taking place to accommodate and engage people on very personalised packages to ensure they're getting access to the boosters. And any of you that are on social media will know that in the UK, one of the radio DJs, Jo Wiley, had a very public campaign to ensure her sister was able to access the necessary supports she needed during some of the early lockdown periods. Again, many of you are very familiar with the learning disability training programs that are happening across the UK and in the 4 countries, England, Wales, Northern Ireland, Scotland, where we are seeing a tidal up and down entry and people wanting to train as learning disability nurses and specialist practitioners. And one of the things that hopefully Christine or Kirsty will share a bit later is a campaign that we're involved in currently to ensure that people really know that learning disabilities is a fantastic career and does save lives. We also know that the consequences are now upon us of working towards integrated health and social care. I've always said that learning disabilities has always been working as an integrated care package, and LD nurses are working in that field and always have been brilliant innovators. But again, hopefully some of that discussion will come out during today's webinar. Oh, thank you, Daniel. You put the link in there of Steve's work. Next slide, please, Emily. So I'm going to hand over now to Ruth, who will talk a little bit about some of the research and transformation that she has been instrumental in leading from the University of South Wales. So Ruth, thank you for joining us, and over to you, please. Oh, you clicked yourself on mute again.
So I don't quite know what's happening there because it just did it when the
I know.
we're near it, so that's quite clever. Okay, so yeah, I've been asked to talk about research and transformation and to say a little bit about sort of my career in research and my career. Trying to get 43 years into 5 minutes is a bit of a challenge. So I've just got some sort of, I suppose, edited highlights. So if I could have the next slide. Okay, so if I look back over my career, I suppose the biggest transformation that I've seen is in services and supports, and sometimes it's only when you've got that distance and you can look back do you realise how much things have changed. So when I first started in nursing, you know, really my only career option was to think about which of the wards that I was, you know, doing my placements in did I want to work in. It was a very much an institutionalized model of care. It was reliant upon sort of long stay hospitals, and we've obviously seen an awful lot of transformation since that point. That's not to say that, you know, there's not a lot of transformation that still needs to continue, but we have seen a lot of transformation, a lot of change over the last sort of 40 years. And I suppose one of the biggest transformations for me in that time, alongside that we've seen in services, is the transformation in research. If you'd have asked me at the point when I started my nurse education 43 years ago, what would I be doing at the end of it? There is no way I would have sort of thought I'm going to be working as a professor in learning disability nursing. You know, such posts just didn't exist. They weren't around. There wasn't a sort of tradition of undertaking research, particularly within nursing generally, but also within learning disability nursing more specifically. And I think, you know, I was beginning to be aware of it when I sort of first started my nurse education, because we were taught about things like the Brooklands experiment, for example, which if anybody's as old as me, they'll probably remember that. You know, the idea that actually if you moved children with learning disabilities from long stay settings to community-based supports, more family type settings, surprise, surprise, you know, things got better for them. But I think, you know, we were starting to see the impact of research, and there's lots of changes which have happened to research over that time. And I think for me, one of the biggest changes that's happened is perhaps the role that people with learning disabilities actually play within that research. You know, historically, people were sort of perhaps seen, I'd like to say as subjects, but I think in some cases people were historically seen as objects within sort of research. You know, they were almost like that it was a human laboratory where we were studying people. But actually now we've moved to a situation where it's much more common for people to work in partnership with people with learning disabilities. And I think that's been reflected within research. I mean, one of the, I suppose, for me, the biggest thing that I've enjoyed in my research career is the opportunity to work in partnership with people with learning disabilities to actually decide what we research, to undertake the research, and also then to use what it is that we actually find out to make an impact in people's lives. You know, one of the big sort of projects I was involved with was a participatory project looking at abuse in the lives of people with learning disabilities, which had a huge impact both on those of us who were involved in the project, but also on trying to raise awareness. But more recently, working alongside people to do things like develop the sort of health profile, which we've got in Wales now, to think about the educational framework for health professionals in Wales, having opportunities to work with people with learning disabilities and also with other sort of stakeholders. But in terms of looking to the future, still a lot that needs to be done. So if we can go to the next slide. Okay, going forward, I think there's a number of transformations that we actually need in research if we're going to be able to meet some of the wider challenges and to contribute towards transformation more generally in services and supports for people with learning disabilities. And for me, I think that one of the fundamental ones is about transformation in how research is viewed. And I've got in brackets and taught, because I think it always saddens me when I hear both experienced nurses, but also student nurses almost dreading that thing called the research module, where people see it as something which is going to be really, really difficult. It's going to be something which is academic and something which we have to get through, but it's not really that sort of linked to our practice. For me, research is a practice-based discipline. The questions which we research should arise from practice. We need to be working with practitioners. We need to be feeding those results back into practice, and it needs to be a continuous cycle. So I think we need to be teaching it and seeing it in a much more applied way, because I think if we see research as everybody's business, not just those of us who maybe are sitting in universities, if it's everybody's business, hopefully it becomes something which is live and which impacts upon all of our lives. We need transformation in how research is used. So, you know, there's lots of research done, and sometimes what happens is that we maybe speak at a conference, we maybe, you know, we might publish an article, you know, hopefully some people will read that, but actually we need to be thinking about research and how it's actually translated into practice, how it's used to support practice, how it's used to develop evidence for change within services. You know, we need to be thinking about it again much more in an applied way. So we need to be thinking about communicating it in a whole range of different ways. And I think finally we need transformation in how research is undertaken. As I said, I think we've shifted to a situation where there's a lot more people who are engaged in research, which involves a range of stakeholders, people with learning disabilities, families and carers, you know, other service providers, but we need much more of that. We need to think about the types of research which we undertake. So, for example, we need to think about perhaps a focus on intervention studies. We need to know what works. If we're talking about transforming things, we need to be developing things which work and provide better supports, better lives for people with learning disabilities. And we also need to be thinking about, I suppose, collaboration around transforming research. So we need to be bringing together people from different disciplines, we need to be bringing people from different backgrounds, and we all need to be working together to try and make research happen. You know, one of the things I often sort of say to students is, you know, research is a team sport. And I think we need to be sort of focusing on that much more going forward to make sure that we harness everybody's expertise and experience and to bring the best research which we can. Thank you.
Thank you, Ruth. So we're now going to speak to Fabian about some of the work that he has been doing on the peer tutor project. So Fabian, over to you. Thanks.
Thank you very much. Can you see my?
Yes, beautiful.
Wonderful.
Yep.
So many thanks for the opportunity to tell you a little bit about this project. I will try to be as briefly as the speaker before. So I want to talk about the Institute for Inclusive Education. This is the first institute worldwide for and with people with intellectual disabilities to be qualified to work as educational specialists at universities. So the aim is to qualify them to be able to work as lecturers in universities fully paid. And you can see on the photo, I hope everyone can see it, one of our qualification groups in Cologne. So this is a German project at the moment. I think it could be transferred very, very well to the UK. And you see that there are 7 people with learning disabilities who are qualified at the moment. There are 3 aims of this project, and I will walk you through all of those aims. The first one is the qualification. So it's a 3-year full-time qualification because we think that it's not enough that someone with a learning disability comes to a seminar, talks a little bit about his or her life, and then goes back to whatever he or she is doing. But in order to be able to facilitate seminars, to facilitate discussions, to hold speeches, they really have to properly learn how to do it, actually. So this is a 3-year full-time qualification. In Germany, we still have a lot of sheltered workshops for people with learning disabilities, and all of the participants have been previously in sheltered workshops. They leave the workshops, they are in this qualification, and then they go to the first labor market. And the content of their lectures, of their seminars, is all about the life realities of people with learning disabilities and of course inclusion. The qualification, we have a module plan, a very detailed module plan. These are the names of the modules. They learn a little bit of theory about employment and education, normality and involvement, but then also very, very important, they have an ongoing module on methods, tools, and techniques of educational work. So they learn actually how to conduct sessions, as I said, and how to deliver lectures. And within these 6 semesters, they very early start to go to universities and have first experiences as lecturers. And of course, during those 3 years, they improve massively, and they gain more and more self-esteem, and they are now really, really good. Some of them who are already on the first labor market, they are, from my point of view, very, very professional. At the moment, I think the numbers are a bit higher now. We have 24 people with learning disabilities in different regions of Germany doing this qualifications. 2 qualification groups have finished. They changed to the first labor market. And here you can see one group of Heidelberg in South Germany and one group of Leipzig in East Germany. So the second aim is inclusion within post-secondary education, because in Germany, the university is, so people with learning disabilities are very much excluded from universities. So we thought, okay, how can we get them in? And the idea was that they have a lot to offer in terms of what can I as a professor not deliver. This is the experience of having a learning disability. And so we training them to teach about exactly that. We have different target groups, but the most important target group are university students. We are guided by the motto of the disability movement, nothing about us without us. And they are able to offer different educational services. Very important to us is that these are not extracurricular, but within a curriculum of different courses of studies. In average, a group of 6 educational specialists with intellectual or learning disabilities reaches over 2,000 people at 40 events yearly. That are the numbers at the moment after a qualification group finished their qualification. And the third aim, I said it before, is employment. Permanent and fully paid jobs. So during the 3 years of qualification, the management team around the group of 6 people with learning disabilities is doing, how do you say, Lobbyarbeit, works very hard on securing those jobs. I know that you are keen on knowing how they are funded. I can talk about that maybe later a little bit more. This is mostly very specific in the region and mixed funding. And after the qualification, they stay together, those 6 educational specialists with learning disabilities, and spread out within the region to different universities. We have collaboration contracts with them, and then they come back to their group and prepare their work there. And that's it, very briefly. Thanks for listening, and if you're interested, I think this is really very good, adaptable to the UK. Let me know.
Thanks, Fabian. Yeah, I'm hoping to work with you. Now you're back from paternity leave on that, certainly at UEA, so we will keep in touch. Okay, over to you, Daniel, now to take us through the Kent, Surrey, Sussex and what it's been like working as a community of practice, please.
Hi, my name's Daniel Marsden. I'm a senior lecturer in learning disability nursing at Kingston St George's, and I'm here part of the Kent, Surrey, Sussex Learning Disability Community of Practice Steering Group. Who would like to introduce themselves? Lisa?
Yes, hello, I'm Lisa Richardson. I am a researcher at University College London and the University of Kent. I'm also a member of the Kent, Surrey, Sussex Community of Practice Steering Group.
Emily, would you like to introduce yourself?
Yes, Daniel. Hello, I'm Emily and I work with Scott and I'm an influencer for Seeability.
That's great, thank you. And Kathy?
Hello everybody, my name's Kathy Bernal. I'm a learning disability nurse and I'm a senior lecturer at Kenton Medway Medical School.
Kathy and Emily, would you like to say something a little bit about the steering group?
Yes, of course. Thank you, Daniel. So as you can see from this slide, the membership of the steering group is pretty mixed in terms of background and role. Some of us are academics, some of us are people with learning disabilities, other people are carers or working in health or social care in other contexts. And we meet on a regular basis. Importantly, Emily is part of this steering group. So Emily, I wonder if I could ask you, why is it important, do you think, to have a community of practice for people with learning disabilities?
Because no matter what disability you've got, you shouldn't be excluded.
Absolutely. So one of the important things about our ethos is inclusion, isn't it? Everybody is included, whatever their background. Indeed. So, Emily, why do you think people with learning disabilities need to lead safe, happy, healthy and fulfilling lives?
Because just because you've got those disabilities doesn't mean that you should be excluded from the outside world. And you have the same rights as other people. And sometimes you might need things adapted, but that's okay. Everyone's different.
Thanks, Emily. Very beautifully put, I must say. And Emily, my last question, I know that you've been a member of this steering group for quite a while and you're a regular at meetings, you're very loyal to it. What makes you keep coming? What do you like about being part of the steering group?
I like learning new things that are outside of where I live, and hearing about and helping make decisions.
That's all right. That's lovely, Emily. Thank you very much for that.
So to talk a little bit about where we've come from over the last year, the community of practice published the Healthy, Safe and Fulfilled Lives shared purpose document in December 2020, and over the last year we've been working to put that into action. We've held 5 online learning events and attracted approximately 400 people to those events. We've also had, as Kathy's referred to, the steering group has run on a monthly basis with hour-long meetings, and we've had various guests along to those meetings to help us think about and shape where we might be taking the community next. Along with that, we've also published 20 odd posts on the community practice webpage, but we realised that we needed to take this further. And so over the last 3 months, we've been working on an implementation plan for this idea about supporting people with learning disabilities to live healthy, safe and fulfilled lives. We still want to run online learning events and to develop our abilities to be able to meet face to face again, hopefully in 2022. We're also looking to develop, and we've started to forge collaborations with other communities of practice, with other service providers, around projects that are aligned with our shared purpose. And we're also particularly interested in starting to design and lead pieces of work that are linked to our shared purpose. Lisa, would you like to say anything about that at this stage?
Thank you, Daniel. Yes, one of the things that we're really excited about for the coming year is we've got a small pot of money to work together as a steering group and co-produce a research idea together. It's really important that as a steering group, we've reflected on how things have been going and to think about the coming year. And that's led us to question what impact the community of practice has in Kent, Surrey and Sussex. Are people with learning disabilities leading healthier and fulfilled lives as a result of some of the activities of the community? And so we're going to take that as an idea and discuss as a steering group, how can we put together a research project to answer this question? We hope then that we'll take that idea and apply for some research funding. It's really important to us that we continue our values that we have in the steering group of working and sharing power equally amongst our different members. And this will hold true in the design of our research together.
Thanks, Lisa. And then the final element that I think is really crucial is that we have got an immense amount of talent on the steering group, and that we want to be able to release all of those skills and those knowledge and experience to be able to take the community forward. And to do that, we know we need to be working with our local partners and with organisations to find an organisation that might be able to support us with the administration of the community, the support in relation to doing online having this online presence, and being able to support us with taking the next steps and making sure that the community has a good foundation for the future. And that, I think, is about all we've got to tell you about right now. But one or two of us will be around in the presentation this morning to be able to answer your questions. And thank you very much.
Wonderful, thank you so much. And that's just another version of that final slide. Next slide, please, Emily. So we're now going to move to an interview that I had with Owen a while ago. He's not been able to join us today, talking about his work in Northern Ireland. And we've also not been able to get Paul Gallen with us today, but we have got Niamh here, who will pick up any questions as we play the next couple of slides. So today I'm talking to Professor Owen Barr, who is part of the European collaborative that we are working with to look at innovations in learning disabilities practice. So Owen, would you be kind enough to introduce yourself and tell me a little bit about your career as a learning disability nurse?
Hi everyone, my name is Owen. I am from Northern Ireland, so that's the accent that you're hearing. I started my nursing career in general nursing as a registered general nurse, and at the time I had a younger brother with learning disabilities when I was about 8 or 9 years old with Down syndrome, who died when he was a child. And just as I was qualifying or about to qualify as a nurse, my mum had twins, and there was another brother with learning disabilities, but with severe and complex learning disabilities. So as a general nurse, I thought I knew everything, and then realised I didn't know a lot about learning disability. Found that I probably couldn't work back in the general hospital again. I summed it up once when we were in a meeting, and there was a lot of discussion about a particularly complex situation, and one of my general nursing colleagues said to me, well, what would you do as a nurse in learning disability? You're used to working in these grey areas.
Yeah.
To which my answer was, no, we don't work in grey, we work in Technicolor.
Yeah, no, I hear that a lot, that the learning disability nurses make really good team leaders because they step back and look at the big picture. They don't just hone in on a problem. Tell me a bit more about what's going on in Northern Ireland and some of the work that you've been doing there to transform learning disability practice, and how people engage and work with people with learning disabilities when they come into healthcare, for example.
We're one of the few places that continues to run a specialist practice course in learning disability. I think we're one of only 2 or 3 universities, and we've managed to keep that going. And one of the ways we've managed to keep it going is being able to show that it really has an impact on practice. As a nurse and learning disability, I do my teaching in universities. I stay close to a lot of work that's done in learning disability. I've sat on, I think now I'm on my 4th board for one of our charities, and that's left me well placed to have really wide conversations with healthcare regulators and Department of Health. Now, there is a review at present of nursing for people with learning disabilities in Northern Ireland going on. That will report in the next few months. We last month advertised 5 nurse consultant posts in learning disability, which have just been interviewed for. We have had for 7 or 8 years now a regional collaborative for registered nurses and learning disabilities in Northern Ireland. And the thing that's important about that is, so I chair that now and have done for the last number of years, but as chair of that, I report directly to the chief nurse. So we're able to put learning disabilities very clearly and the work we're doing in front of the chief nurse.
You were telling me earlier about how you worked out you needed to change some of the language you're using in order to get the traction needed to get some of the innovations that you've established really get hold.
So just using one as an example, which was the development of a hospital passport for people with learning disabilities. I made a deliberate decision that every time I talked about the passport at a conference or in a meeting, I talked about patient safety first. And I said there is a very important patient safety issue about what's happening for people with learning disabilities, and the passport is a possible solution. When we revised the guidelines and we worked with RQIA, we wrote into their recommendations that there should be a passport. We deliberately had the Director of Nursing from the Public Health Agency and the Chief Nurse from Northern Ireland launch the passport along with people with learning disabilities. I was able to secure a payment of fees for a PhD student to come and do a full-time PhD. And that student is coming to the end of her project, and what she's doing is evaluating the impact of a passport being used.
What are the families saying about the use of the passports? Is it really giving them access and getting them the personalised, safe and effective care that they need?
When it is used. So a lot of families are very positive about it, but there are still a challenge that sometimes the passport is handed over and somebody reads it and puts it down, or it gets put in a file. Neve Walsh is the PhD student who's doing this work. We done some work on the analysis yesterday, and a number of people with learning disabilities commented how nice it was to have a passport because they didn't need staff speaking for them. It was refreshing. I was about to say unexpected, but I hadn't fully appreciated the impact that somebody with learning disabilities might think the passport had.
So anything else, Owen, that you can say to people on the webinar that will inspire them about keep going with transforming care for people living with learning disabilities?
I think it's great to have ideas, but then what you need to do sometimes is pause and work out the strategy to make those ideas possible. So sometimes you need to plan just a bit further ahead. When I work with my specialist practice students and with colleagues, and we're trying to build up how we would present a case for change, we sit down and we ask ourselves the question, what is keeping this person awake at night? And how can we present what we want to do in a way that will help them sleep better? We can be very passionate about learning disability sometimes, but often we speak a language that we got to convert it to a language that becomes a priority for the other person. Raising a patient safety issue for people with learning disabilities can't be putting a long finger and it needs action. So we need to think about our wording sometime. Language is so important, isn't it? Well, thank you, Owen. I appreciate your time and hearing more about what's going on in Northern Ireland, and I look forward to working with you next year. Thank you very much. Whatever we get up to. Yes, all the best for the webinar. All right, thank you. Okay. Bye, everyone.
So before we launch into this next piece of film for you, Neve, do you want to just give us a brief introduction as to how this came about?
So this was, I remember very early on when I started the PhD that I was looking at the evaluation and the impact of the passport, and I was kind of going, do people actually know, do people actually know about this? And disabilities, we know that the passports have existed forever, amen. We've always used them. But I was looking in the general hospital settings at the impact of the passport. I thought, but people don't know about this. So I said, how can we raise awareness about this passport that exists? So I had seen some work done actually in the business arena around how a community, a town, had within a very short time frame, in a very creative way, showcased their wares across the whole town. So of businesses, between banking and garages and shops and supermarkets and clothes outlets. And it was and I just thought, how can I apply that to sharing the message that we need to share in relation to people with disabilities and the passport? So this is where the idea really came from. And we've always had to raise our head above the pulpit, really, haven't we, in relation to anything we do around awareness when it comes to disability. So we just sort of went hell for leather, really. We threw the rule book out the window a little bit, and then and this is what we came up with. So as opposed to Mission Impossible, we called it Mission Possible. So
thank you, Niamh. Okay, Emily, hit the button.
Health passports are being brought into Ireland. They are full of information.
Lad, it's the middle of the night. You're indoors. Take those sunglasses off. What? I'm keeping these.
Hey, you! Where'd he go? Where's this way?
Health passports help let staff know all about our abilities and needs.
Monster! I can't see anything in these sunglasses. There he is!
We want to see the passports used all over Ireland. Like they are in other countries.
Okay, Paul. Why is this health passport so important to you?
This could be a matter of life and death.
What do you mean, Paul?
It means involving us communication, consent. Let us make decisions. This is about our human rights.
You think this is the answer?
I don't think it's the answer, because I know it's the answer.
It's okay, guys. Everything he says checks out.
I told you so.
Excellent work, Agent. Here's a word from the Chief.
Well done, Paul. The launch of the health passport is going to help staff make reasonable adjustments to ensure people get the care they need.
Here's your own passport, Agent. I think you're going to need it, because here's your next mission. Remember, it's top secret.
Everyone down.
This message will self-destruct in 5 seconds. 4, 3, 2, 1.
I find the face. Okay, 84, where's wire?
The red wire, Agent. Cut the red wire.
Some people without have passports will struggle to communicate with staff. Where's wire, Agent?
The red wire, Paul.
Do we know anything about this young man? Is he on any medication?
It's all here. His name is Paul. He has no medication and he has no allergies.
Have passports offer everything from medication taken to ING to mainland.
Okay, what happened to this guy?
He was in an explosion, Doctor.
An explosion? We don't see that every day. Do we know anything about him?
Everything you need to know is in here.
Let's make sure whoever is working with Paul reads this passport so they can make the necessary adjustments to give him the best possible care. We're going to need to do a carbon monoxide test, and then we're going to get in touch with your carer. Somebody called M?
Always have to play the hero, don't you, Paul?
Congratulations, Paul. You've successfully completed your mission. Hold on to your passport now, Agent, because I think you're going to need it again.
Speaking of which, here's your next mission. Everybody out.
This message will self-destruct in 5 seconds. 4, 3, 2, 1.
Gosh, how to follow that. So thank you so much, Niamh, and for sharing the link in the chat there as well. So
sorry, Sally, can I just add? Someone just asked about in your there was a comment there about an app. There's an app available on the Apple App Store and the Google Play Store. The HSE Health Passport is available for free to download onto your device now. So it's just HSE Health Passport ID. If you search that, you'll get the link. So I'll put up another link to another video in the chat and that information.
Bless you. Thanks so much, Niamh, for that. And do give our best to Paul as well.
Sorry you couldn't be here. You did
yeah, I bet. Yeah. Okay, so I'm aware of the time, and here are some links for you to go and look at that are practitioners talking about the influence that they are undertaking as LD practitioners in their various areas of speciality. And so if we could move to the next slide now, please. Yeah, we'll miss that one, I think, Emily. Thank you. Carrie, sorry, love, you haven't been able to say very much so far. Do you want to come here and now share some of the work that we've been doing in the collaborative workforce transformation?
Thank you very much. I was enjoying that so much. Sorry, I got completely carried away. My head in Mission Impossible there with the lovely Paul. Yes, thanks, Sally. The Collaborative Workforce Transformation Academy launched last week, and it is an initiative that provides a whole range of learning and development programs for system partners in health and social care settings. And these programs can be undertaken either as individuals, whole teams can commission us to undertake education programs with them that are bespoke for their particular setting. And then there are programs that target both national and international partners. And they focus on 3 key themes. And they are around how we help to develop the leadership capacity of our workforce, how we develop the facilitation capacity for culture change, innovation and improvements, and how we develop embedded research so that we're focusing on developing research programs with experts by experience in real time, in practice, focused on what matters most to people. So the Collaborative Workforce Transformation Academy provides a whole smorgasbord, if you like, of different programs that you can have a look at. And you can commission them as organisations, or you can undertake into practice. And for this particular field of expertise, we're obviously extremely keen to work with system partners to help support innovation in LD services and LD practice, whether you're working at regional level, national or international level. And that may be, of course, through some of the collaborative partnerships that we showcase work with today through Kent, Surrey and Sussex Community of Practice for Learning Disabilities, through our European Learning Disability Community of Practice, with our colleagues in Ulster, Wales, Scotland, so on and so forth. So please do get in touch with us about that. But linked to the Workforce Transformation Academy, we're also launching 5 new communities of practice. These communities of practice are focused on culture change, on leadership, on embedded research, facilitation and innovation and improvement, and we will be putting out dates for practitioners to come and join us in those different communities of practice shortly. My colleague Jonathan Webster is starting the community of practice for culture change tomorrow, and that's linked to some work that he's been doing with the Foundation of Nursing Studies, which he may of course come on and talk a little bit about, maybe if we've got time. And both Sally, Kim and I will be sending out dates for some of the others shortly, and we do have a Facebook page where you can actually find out more information about these communities of practice, as well as having a film on YouTube. If you click on the link that I'm hoping Emily will put in the chat, you can find out a lot more about it. So next slide, please. Here's the links. Thank you very much, Emily. For additional information, how to get in contact with us, you can click on information about our impact research group. You can commission us directly to do research with you or co-design programs of learning, innovation and improvement. Lots of examples that we might get time to talk about, or you can look at our other films about work that we're currently doing. There's a narrated PowerPoint about the Workforce Transformation Academy and the communities of practice. You can find out more about what we've been doing in our annual report on our Impact website, and you can also follow us, of course, on Twitter and link to our Facebook page. So I think that's all from me. Thanks, Sally. Back to you.
Jonathan, do you want to close for us?
Absolutely. So thank you, Sally. All I can say is what an amazing webinar. This is our final webinar of 2021, and what a great one to close the year on. So thank you to Sally and to all participants. It's been really great. And I have to say, I think I'm probably going to have that Mission Impossible tune in my brain for the rest of today, even if I don't start humming it as well, which would be a good thing. So our next webinar in the new year is on January the 18th, and that is Leading Sustainable Change at Scale, International Insights. And for this webinar, we're going to have an international number of participants to join us for that. And it's going to be run twice on that date, firstly at 8:30 in the morning, and then again it's going to be run at 12 midday. We draw your attention to the Collaborative Workforce Transformation Academy. If you'd like to know more, please do get in touch. And if you'd like to become engaged with our communities of practice, we would really love to hear from you. So to finish, at 1 minute to 1 o'clock, just to say thank you again for joining us. Thank you for supporting our webinar series throughout the year. And from all of us, we would really like just to wish you a very peaceful and safe festive period. So thank you all.